Good evening, everybody. How's everyone doing? Good. We're going to get started. They want us kind of on track. Welcome to Barton Health Lectures. And today we're going to talk about increasing the power to your pelvis and gaining some control. How many people here do Kegel exercises? Every day? 80 a day? Because actually what's recommended is 80 Kegels a day. And typically, 80 to 90% of women will do them wrong. So what I want to do today, my whole goal today is to make sure we all do them right. And all right, so what we're going to do today is I'm going to teach you about the anatomy of the pelvic floor and how it works. So that means we're going to have a couple of pictures that's later down in the, just to warn you, there's going to be some anatomical photos we're going to go over. And what we're going to do first is kind of talk about the bladder and how the pelvic floor work together. And a lot of times with some people, there's a little bit of dysfunction in that relationship, and we're going to teach you how to fix it. We're going to learn the proper way to do that pelvic floor contraction, and we're going to work on strengthening the pelvic rotator cuff. And we're going to kind of get into that anatomy as well. So, no, stop. Nope, there. So this is basically what happens. We're going to take number one, and that is the bladder has been emptied. And there's about I think about a 50 milliliter residual that's normal. So the bladder muscle, the detrusor, is relaxed. The pelvic floor is contracted. There's no leaking. Then, and this is about a 3-hour period. You start to get that first sensation to urinate, about 5 ounces of water, so little over half a cup, and it goes, you get that first stretch reflex, and that's when everyone goes, ooh, I gotta go to the bathroom. You can wait, but everything is still tight. Stop it. There. Pointer. Okay. This still stays tight. And as we go along, you get another stretch reflex, and that's about 20 ounces of fluid. And then you got to go find some place to go. And this is typically what you want to wait for. You have that strong desire to go, you're full, you go over to the bathroom, and what happens is the bladder contracts, the pelvic floor relaxes, and you empty your bladder. 20 ounces is like a venti mocha at Starbucks. It's a lot of fluid you can hold. Okay. And again, the bladder is a reservoir. Normal capacity is you can hold up to about 600 milliliters, which is about 2.5 cups of fluid. It takes 15 drops of urine a minute and about 3 hours to fill. So that first urge, again, is about 5 ounces. You can wait. So a lot of bladder training is teaching you to wait and not panic. All right, you can hold it and you find that bathroom. The bladder is going to contract, the pelvic floor muscles are going to relax. And what people do in public bathrooms is no one wants to sit. So we hover and we try to pee without sitting down, and as we do that, the pelvic floor muscles are tight because you're in a semi-squat, so the bladder can't fully empty if the pelvic floor is contracting. So that's kind of put paper down and sit. It's a lot easier. Okay. You don't have to push. You shouldn't have to strain. 2 to 3 hours between emptying your bladder, and here's the key. 6 to 8 Mississippi. So you're counting 6 to 8 seconds, and you're relaxed and you're sitting there, and you should be able to do 8 Mississippis. If it's less than 8 Mississippis, you could have waited. So that's a nice way to judge. Once a night, getting up is considered normal. Okay. And here's where we get the control from. So Bradley loop, as the bladder contracts, the pelvic floor is going to relax. If you don't want to wait, or if you want to wait, you do a pelvic floor contraction, we say do 3 contractions for 6 seconds, and that's going to tell the bladder to back off. And so a lot of people tell me, I get up in the morning and I'm like, God, I got to run to the bathroom, and I make it there, I barely get my pants down, and I'm peeing. Before you get up, you're going to sit on the edge of your bed, you're going to do a couple of pelvic floor contractions, and you can get up and calmly go to the bathroom. What they call keyhole incontinence, which is, I don't know many people that have keys anymore, but you're trying to get into the house door and you're panicking because you got to go, and you kind of do some leaking beforehand. Anytime you have that trigger, you can take a break, do some pelvic floor contractions, allow the bladder to relax, and proceed calmly. And then semi-squatting. People do pelvic floor exercises on the toilet because they practice trying to stop their stream. It kind of messes with that whole system of bladder contract, pelvic floor relax. We don't want to contract the pelvic floor while you're trying to do a normal thing. It confuses the system. You can try it and say, oh, see if I can stop it, but don't make it a habit to practice that on the commode. And you shouldn't, again, have to bear down and push. It should be nice and calm. The just in case peeing is you're going to go down to Carson City. I'm going to go just in case. I know people that know every bathroom along the way. You don't. You know those people. You don't have to do that. You just kind of get yourself in a habit of going 2 to 3 hours at a time. Okay. And a lot of times with the incontinence, people consider it, I'm old, I've had babies, it's a natural thing. It's really not, we don't want you to consider that normal because you can change it. Okay, 15 to 25 million Americans have some sort of incontinence. Women 30 to 59, 26% of them have some type of incontinence. 11% of women over their lifetime have the risk of undergoing an operation for a prolapse when the organs start to kind of come down and come out of the vaginal canal. Women in their 20s never had children. This study, 450 female soldiers, because of the marching and the pounding and the constant pressure on the pelvic floor, had some leaking. So it doesn't have to deal with age. It just has to deal with how the muscles are reacting, how healthy they are, how they're dealing with the stresses that are put upon them. And from the rehab standpoint, we do a lot of pelvic floor muscle strengthening and behavioral techniques. And we're going to get into the pelvic floor now. Now, the pelvic floor contractions, Dr. Kegel was an OB-GYN, and so they named the exercise after him. He built it with a biofeedback device, what they call a pressure periometer, that you insert into the vaginal canal and you squeeze. And the early ones would kind of like the strongman competition where you hit the thing that you can squeeze and the dial goes up and it comes down. We are in 2017 now, and what they have are Bluetooth vaginal exercisers. You can play with your phone, yes. And they vibrate. So we call them the rabbit. So you put it in, and if you do the contraction properly, it'll start to vibrate. It gives you that feedback. And the reason why feedback is so important, as you're going to see when we look at the anatomy, is if I'm testing the muscle, I have to go up to my knuckle for the muscle to grab on and pull up. And that's what we're testing for. If I squeeze my muscle, you're going to grab my finger, pull it in and up into the vaginal canal, and that's what those muscles do. You can't see them. It's not your biceps you're looking at, so you have these feedback devices so that you know that you're doing it right. I've had patients kind of go, well, it keeps popping out, and that's because they bear down and it pushes out. So having something there that you can try to pull, and it's that drawing in, and even we're going to practice the pelvic floor in exercise in a second, picturing that idea of grabbing it and pulling it inside. On the Apple, you get 4 games. The Android only has 3, I think. It's kind of, they're not as techy, I guess, as Apple. We also have a surface EMG unit. where we put little pads around the anus, and then as you contract the pelvic floor, you can look at a TV screen and you can see it. They actually have pictures that you can launch a rocket, you can make a flower open, and you're sitting there, it's like, oh, I can do this. And a dolphin jumps out of the water, and we use that for children. Yeah. You can use it for children because, again, we're not going to do anything internal on a child, but we can put these electrodes on them and they can play with the video game, and teaching them how to regain control of the pelvic floor when they're having issues with continence. And again, visual biofeedback using a mirror, and I've had all my patients look, and I'll get into that when we do the pelvic floor muscle itself. And again, the pressure biofeedback device, that is my teddy bear. And these are where the electrodes go. It's got a very strong pelvic floor. And this little ground pad typically goes on the glute. All right, so visually, you're looking at a mirror. When you do the pelvic floor contraction, you're looking at your clitoris, you're looking at the anus, and it should wink. Because again, it's a drawing in. So we want to see the clitoris drop, the anus drop. With the man, it's the base of the penis, and they're all kind of winking together. What I see with a lot of women that have dysfunction is they're not getting that upper wink. They're only getting the rise from the anus. They're not getting that drop. And that drop is at what we call the superficial. Here's our first photo. Here's our superficial urogenital triangle. Those little muscles, and if you see the green here, they all lead up to the clitoris, which is here. So that is when we try to get you to contract that muscle, we like to say, think of the clitoris as a turtle head, and you're just tucking in your turtle, kind of pulling in. It's very subtle, it's small. These muscles in real life are thinner than the diameter of a pencil. You're not lifting weights with them, you're just gently tucking. And I always put my hand out, use my finger as a visual feedback, and kind of helping the brain along with it. So try that. Try tucking your turtle. And it's a very small motion. And when we get to, and as you can see, as you contract that, that should drop. Okay. So the exercises that we work with are turtle tucks. You're tucking the clitoris or the penis inside, and it's a small motion. When we do endurance, I want you to tuck that turtle first, and then I want you to pull it in a little bit deeper. So you're getting a little bit of a tuck, and then pulling in deeper, and you should feel that drawing up. And with the endurance holds, you try to hold it 5 to 10 seconds, 5 reps. If you feel like you're losing it, let it go. There's small muscles, they fatigue easily. If you're starting to squeeze your knees or crunch, stop. Snipers, because all muscles have endurance fibers, these muscles have endurance fibers and quick reaction muscles. So the sniper is 1 second on, 1 second off. You're in, off, on, off, and you can try that up to 10, but again, if you start to lose it, stop. There's no need to push. What a lot of people have issues with is the relaxation. They kind of, well, I can't relax it anymore because they keep drawing it in. So trying to be able to get it on and off is important. A lot of my patients love the elevator. So it's a very gentle contraction, pulling it in, up. How many floors can you go up? The key is slowly bringing the elevator back down. I had a coworker, and he told me I got 4 floors up. I'm like, how many down? He goes, it was a free fall. Everybody in the elevator died. So save your little people. Gently bring the elevator down. Okay. And here's my super tip for the day. This is the sensory motor cortex. It's the area in the brain where we have sensation and motor for different parts of the body. So right here is where the genitals are, your pelvic floor, and just above it is toes. So if you've been practicing your turtle tucks, Now I want you to curl your toes and try it again. As you curl your toes, what happens is you get overflow to the genitalia, and that helps the brain cue in and get a stronger pelvic floor contraction. So if you're going to try the elevator, do it without curling your toes. If you're going to, and then try it again, curling your toes, see if you get a better sensation. Okay. The neck. I don't know why they call it the neck, they just do. It's a test I do where I'll look and I'll go, okay, cough for me. And when you cough, the vaginal opening should stay closed. If it opens up, the muscles aren't doing what they're supposed to do. So then I will have you do a Kegel and cough again. And what I'd like to see again is it should stay closed. You can do this as an exercise because it is resistive, because coughing has abdominal pressure down, so you kind of put stress on the pelvic floor. So you can practice that, squeeze it in. It's also good for, again, behavior modification. If you're one of those people that has a little bit of leaking when you sneeze or you cough, then you can do your pelvic floor contraction and practice coughing, and just kind of use that as a resistive exercise. And training the pelvic floor to kick back in when it's supposed to. Also, a lot of people will have a little bit of leaking when they stand up. So you would pull in your pelvic floor and stand up and then sit back down, and just training your muscles to do their job if you're having issues. And again, I would have people try it in a mirror so that you can see. Again, the same reason, it's a muscle that you cannot see, so you're using different things to kind of cue your brain and cue your pelvic floor together. All right, so 80 a day is what we recommend. And I'm easy. With the elevator, if you can get 5 floors up and 4 floors down, that's 9. So, you can do 10 elevators and you can be done for the day. And you want to use your pelvic floor contraction with a lot of your activities. If you're lifting anything up, you kind of tuck your turtle, lift up, climbing stairs. And what I tell a lot of my patients is during sex. Because again, you have something inside the vaginal canal that is giving you feedback. So you can grab a hold and pull it in deeper. And if you can time it right, coughing and sneezing and laughing. Okay, so again, this is the side view. This is your pubic bone. Here's your coccyx. And again, here's your rectum, the anus, the vaginal canal is here, the urethra is here, and right over here is where your bladder is going to be. And this is your obturator internus. It's a hip external rotator. Here's your piriformis. Anybody with low back pain or sciatica is very familiar with that muscle. And here's your levator ani, your coccygeus, your pubococcygeus, and they actually come in and attach to this ligament right here, your arcuate the arcuate tendon, which is part of the obturator internus. So when you externally rotate your hip, you tighten the pelvic floor. This is the right side, there's a left side. And again, this is what I was talking about, the pelvic floor kind of bridges the right and left side together. A lot of people with hip pain will have restrictions on the side that they have pain, and that can cause restrictions in your pelvic floor. The same with the low back pain and sciatic. A lot of times sciatic pain can be relieved if you're not getting through the piriformis by kind of going in and working on the obturator internus. Okay. So, diaphragmatic breathing. And this video hopefully will work. Maybe not. Okay. So, I'm not sure how to make this go. because it didn't pop up.
Oh. I don't know what we've got going on there.
That's my link. All right. All right. So that's not going to come up. But when we breathe, so the abdomen is a container. We like to call it the Coke can. Your pelvic diaphragm and your respiratory diaphragm, when you diaphragmatically breathe, the respiratory diaphragm drops, the pelvic floor should drop. As you exhale, everything rises again. So you're getting this nice, smooth, wave-like motion, and that helps the pelvic diaphragm stretch and keep its mobility. We have been taught since, we'll say preschool now, once you start sitting in a chair, it's kind of difficult to diaphragmatically breathe, so we do a lot of vertical breathing. We get that, the chest comes up, we don't drop our diaphragm. It's not aesthetically pleasing to diaphragmatically breathe because your abdomen extends a little bit, so we're told to hold our breath in and don't let your stomachs, hold your tummies in. That's not the best for this diaphragmatic breathing and this working with the respiratory diaphragm and the pelvic diaphragm. When we diaphragmatically breathe, you have increased oxygenation, the lungs fill up more with air. Again, your pelvic floor will drop and have a nice stretch as it comes up, and it will help decrease your autonomic nervous system. They're saying stress is huge and is a tremendous factor in our lives these days, and practicing meditation 10 minutes a day, diaphragmatically breathing as you do that can reduce your stress significantly. It relaxes your autonomic nervous system, and it calms everything down. So beyond just your general mental health and your physical health, diaphragmatically breathing is also going to help maintain the health of your pelvic floor. How many people meditate 10 minutes a day? Oh, good for you. I don't. My brain doesn't shut off. I'm working on it. It's my work in progress. But practicing diaphragmatic breathing. Look at dogs, look at your children, look at babies. They breathe diaphragmatically, they breathe correctly. Once we start going to school and we sit, we get trained out of that. Again, they say 80-90% of people will breathe wrong. And it should be the most natural thing to do, but we've been trained to do it incorrectly. There are, I'm sure, hundreds of videos on YouTube teaching you how to breathe, different types of breath. The Winter Olympics were on this year, and anybody watch the biathlon? Those people like sprinting, stop, drop, and can shoot a gun with that kind of accuracy because they can control their breath. So get that biathlete control of your breathing. It's going to be able to relax yourself when you need it. Okay. And that's not going to show up either. Anybody see the video from the BBC with the animals? They do the animal voiceovers, and there's this blackbird in the beginning, and he's going, nighttime, daytime. I love that video. I love animals with the voiceovers. But I like using that video because this is going to work with the pelvic floor and the breathing. As you open up, you inhale, it's like daytime, you inhale, you're awake. I'm going to show you this second. We're going to open up the legs. Everything opens up. And as you exhale, it's nighttime, everything closes, and everything comes together. And I'm going to show you that now. And again, this is what we like to do with this pelvic floor rehab with the rotator cuff is we're going to work on the obturator internus. We do not go past shoulder width. Once you go wider than that, you're going to start kicking in your glutes. We want to focus specifically on this obturator internus. And you're going to inhale as you open and exhale as you close. The next video is specific to, well, you're just adding a little resistance to it. Again, you're opening as you inhale. Your respiratory diaphragm is going to drop. You're going to open. And this is about a 5 to 6 second exercise, and then you're going to exhale over that same period of time and bringing it in. We want as the obturator internus is strengthening, it's going to help strengthen that pelvic floor. As we relax it, as you use your adductors, it's going to help relax the pelvic floor. And again, with this, the first one, we had your feet together because because we're only going shoulder width. When we work the adductors, it's going to be shoulder width apart, and you're going to bring in. So again, you're open, shoulder width. You can do this sitting or laying down, and I have other pictures. You're bringing things together, you're squeezing, because that's relaxing the pelvic floor. And as you inhale again, you just return to that starting position. Exhale as you squeeze, inhale as you open. Then again, that whole nighttime, daytime. And I'm from New York, I talk with my hands, so I always move my arms when I do these things, and I think it helps too. And this again is just adding resistance, so a really soft, squishy ball, a soft pillow, a balloon. You don't have to, you're not powerlifting here, you're just kind of getting that muscle to contract, adding a little bit of resistance and opening back in. And again, as you exhale, you close, working the adductors, relaxing the pelvic floor. And as you inhale, you open, and you're using the obturator internus. This is just a position. This is what I will do with people that have prolapse. So their organs are starting to drop out. You put your butt up onto a little wedge or onto a pillow, and it allows the organs to kind of fall away, gives you less resistance on those muscles. That actually helps put them in place while you stabilize and you do the exercises. I had worked with a woman that she had a lot of pressure. She didn't have to actually push her bladder back up. But we did 5-10 minutes on the wedge doing these exercises, and she got up and she's like, I don't feel it. I don't feel that pressure coming down. So just 5-10 minutes a day, if you're having a little bit of prolapse, being in this position, even not necessarily doing the exercises, is going to allow things to fall away and take some of that pressure off of your pelvic floor. As we get stronger, we do it side lying, and this is, again, just shoulder width apart. You're not opening wide. I know in rehab, I typically have people doing the butterflies and you're being real wide, big motions. This is small. This is just up to shoulder width. When you get really good, you get into a plank, side plank, and you just lift that left leg and just kind of working that. And that's just different ways to progress it. But again, it's a small motion, really specific to those obturator internuses. This is a standing plie where your feet are apart and you're just dropping 3 to 4 inches, just enough to open. And again, with the breathing, lower yourself as you inhale, as you open, and as you raise and you exhale, it closes. So we're working on that, getting in your mind. That's why I like that daytime, nighttime, because it keeps you in that rhythm. It gives you a visual, and so much of visualization helps with doing the exercises properly. They find with the pelvic, with biofeedback, you can get upwards 73, 97% improvement just because you know that you're doing it right. And that's with the old biofeedback units. It would be the same with the rabbit device, which is actually, I should call it what it is. It's the Kegel, and you can buy them on Amazon.com. But again, like any muscle, it's not an instant fix. It takes 3 months of specific strength training for a muscle, and these muscles included, to really make the long-term outcomes. But looking at some of those tricks, like a lot of it is just awareness. So doing that kind of turtle tucks, toe curling, just some of the leaking, doing the pelvic floor contractions when you have that urge to kind of relax the bladder can give you that time. And I've had people come back a week later and go, yeah, I haven't leaked. I just do those pelvic floor contractions. It calms everything down and I can make it to the bathroom. So those things, that urge, contracting the pelvic floor, calming the bladder down, can make a huge difference. Okay, and again, 3 to 4 hours. Working up to that once every 3 to 4 hours. You want to avoid constipation if at all possible. 8 Mississippis on while you're urinating. And again, working, and we didn't really go into it, but working on abdominal strength and core strength along with this, but making sure that you know that you're doing the pelvic floor contraction properly first before you start incorporating a lot of the core work. Because those muscles are small, they're easy to overpower, and you want to make sure that you can get that turtle tuck as you're doing things. And of course, everything that is awesome irritates your bladder. So any of these things, any of these things are going to make you want to pee more. And that is, I know that was a lot. Anyone have questions? Everyone try the exercises as we went through them?
Yeah. Are you giving classes?
Hmm?
Do you give classes?
Yes. So, no. We do treatment. So I work at State Line, and I'm only there 7, 8, and 9 o'clock on Tuesdays and Wednesdays because I do home health. But I will treat patients at those hours, and I try to accommodate other people as I can. So if you're having issues, you just ask your doc and say, hey, I want to see that, and we can have you come in. And typically, sometimes rehab is 2 to 3 times a week. For this, it's once a week, once every 2 weeks. It doesn't have to be something I do every day, depending on the issue, every week, depending on the issue. It's a lot of homework for you, a lot of you're taking the time, sitting, relaxing, doing this. But I think this is going to be on Facebook now, so you can watch it anytime and review. But if you have any questions, you can give the State Line Rehab office a call, and I can answer questions. The other thing I didn't necessarily get into is a lot of what we do is also with pelvic pain. And getting back to the muscle slide, here, again, if any of these muscles are tight, it's going to cause tension on one side, and that tension can cause you to, anyone have a catheter? And after I started doing these courses, I always felt bad because I'd work in the hospital with people and they have the catheter and they're like, oh my God, I have to pee. And we all, well, you have a catheter, go ahead. But what happens if there's tugging by the catheter on the urethra, it just gives you the sensation that you need to pee. So I apologize if I said that to anybody. But any tension on one side or the other is going to pull on the urethra, and it's going to give you that sensation of constantly needing to pee. And that's what people say is like, oh my God, I sit down and I pee, and then I stand up and then I have to pee again, and they sit down, and 10 minutes later, if there's tension here and there's pulling, it's constantly giving you that sensation of needing to urinate, and that's just because there's muscle imbalances inside the pelvic floor. So doing a lot of deep breathing, that there's very few things that you can do to stretch the pelvic floor besides deep breathing and going in and massaging those things. So, but deep breathing is key. You can do that 10 minutes a day. It's going to be really helpful. Yes?
Can you talk about the process of what needs to happen if they want to come see you?
Oh, so you talk to your doctor, and that's with your primary care physician, your OB-GYN, the urologist. Those are your doctors, this general surgeons as well, pretty much. Anyone, and your primary physician say, hey, you know, I'm having pelvic pain, I'm having issues with urinary incontinence, bowel incontinence, it's all the same muscle groups, and they can make a referral, and they will send that to State Line, and we'll work with you. Looking at this, anyone that's had a hip replacement can have frequency issues where you have to pee all the time because, again, the obturator internus is as affected because it's not working as much because of surgeries, because they're weak. Questions? It's a lot of info. Okay.
Can men use those devices too?
What?
Can men use those devices too?
Not this one, because it's really it's made to enter into the vaginal canal, and this one's never been used internally, but you can check it out if you want to. It's really firm, and that's actually the complaint that I've gotten about this, is that it's hard to insert, especially if you have some tenderness in the canal. And this is the video that, you know, the breathing. You can kind of see it rises and falls together, and you see the abdomen come up. This is perfect. That should be your vision as you breathe. So the devices are meant to be internal, so for men that would have to be inserted anally, and I don't think I know many men that would want to shove that up there. Just saying, it's not comfortable. They do actually have with other devices electrodes they have electrodes that you can insert vaginally and anally to stimulate the pelvic floor, and those are really small. They're very narrow for comfort. I don't have those, for that matter, but any other questions? My suggestions for women if you're in a couple, again, the stronger your pelvic floor is, just for other continence and other things, it also helps with sexual activity, and practice grabbing and squeezing onto your partner, because that's going to give you feedback and he can give you feedback, because if you do it right, he'll let you know. But it just helps strengthen the pelvic floor, especially during activity where it's supposed to be strong.
Can you talk to about postpartum for women who might be
Yes, I actually worked with, and that's more with, there's some leaking involved. If again, I don't know if we can go back to that, but as the baby comes out of the canal, birth can be traumatic. So as the baby comes out, things can get stretched. You can get some tearing. That one, the 8. So you can get tearing kind of from the vaginal canal. You can get some tearing down. A lot of times the doctors will do an episiotomy where they cut to assist the baby to come out. And there's scarring that happens, and then those sometimes, depending on the amount of scar tissue you lay down, that can be really painful. So you go in and we can teach people how to stretch those areas. We can teach you how to regain that control of your pelvic floor, because everything gets stretched. When you're pregnant, the hormones are increased, so everything's lax anyway. But we can, again, work on strengthening and stabilizing the pelvis through the pelvic floor muscles, releasing any scar tissue. And again, these are regular muscles, so they can have like a trigger point. You know, you got the Spock spot here, you can buckle anybody. That can happen in your pelvic floor as well. And I'll note, and people have said, oh my God, I had no idea that was painful until you actually push on it. And doing those releases in this area because of the pain, and teaching people how to teach their partners to do it as well, so that they can continue with that release at home. Again, a lot of women if you have a diastasis where the abdomen starts to split because of pregnancy, we can work on releasing that fascia and allowing that gap to come back in and just regaining that abdominal strength and the integrity of the muscles in the whole, the canal, no, not the canal, but through your core. Yes?
So what if you're waking up 3 or 4 times in the night to urinate?
Okay. That's, well, you know, it's definitely not ideal. We would consider once a night as normal. So what you want to look at is how much water you're drinking at the end of the night. How much alcohol are you drinking? Because again, alcohol is an irritant, and that's going to make you want to urinate more. We have a lot of people that have swelling in their legs, and when you lay down, all that swelling goes back up into the system, into the kidneys, and you wake up and you got to go pee. So if I would have people lay down about an hour before they go to bed, ankle pump, raise their legs, get the fluid out, and then they can get rid of it before they go to bed legitimately go to bed, and that can help decrease that. You know, again, and I would ask, well, how much are you urinating? Is it a lot? Is it a little? Can you get to 8 Mississippis each time that you do it? If not, then it's just a matter of retraining the bladder to go, okay. And I would say if you're waking up and you're like, oh, it's too cold, I really don't want to get out of bed because it snowed last night, I would practice doing your Kegels and just seeing if you can get your bladder to just kind of relax a little bit, kind of take advantage of that Bradley loop and just help get the system to calm down and retrain it.
Do they still do that mesh surgery to pull things out?
You know, they're still doing the surgeries I think they are still doing the mesh. I don't, you know, I've seen some. They do lift surgeries. I think they might be using other things, but they're still doing a lot of those surgeries to pull things up and kind of get things back where they should be. They do the suspensions. And they are, I think they're still doing mesh. I've had a couple of patients with mesh. And those work, but just because they lift everything up doesn't mean you're off the hook from doing these things, because you still want to maintain, you still want to get stronger.
Would you recommend it for a 90-year-old lady? They did that to my mother and it didn't work at all.
I would say that's a question for the surgeon and what their rationale is for doing that. And so I don't know, I can't really say, because I don't know what the situation with your mom. But you tend to, the surgeons have their criteria and their indications to do things. And so that would be a surgical question. But didn't help at all? Is she still with us? No. Okay. I would say, have her tuck her turtles. And and this is actually it's interesting because I've worked with 90-year-old women before, and and some of them are Catholic, and I know I was growing up, you go blind, you work with this area. So I always tell them, I promise you're not going blind, just do your turtle tucks. And it works. So it doesn't matter your age. I've had success with 90-year-old women doing these things and have gotten more control of their bladders. So it doesn't have to be age, it doesn't have to be normal, you just got to stay on it and keep it healthy. Any questions? Men, 80 a day, just saying. Tell your partners you got to do them 80 a day. It's important for them as well. They don't necessarily have as much issues because the urethra is longer because of the penis and there's just more pressure, but they can still have leakage, especially after prostate surgery. I've worked with a lot of guys after that and have had success with it. So men, do your Kegels, not just for women. Okay. Any questions? Yes?
Okay, you said you tell your doctor if you have urinary incontinence, and then you refer them to state line. Now, what do you ask for specifically?
Just say, I'm having these issues. I'm having problems with bladder control, and I'd like to try physical therapy.
I would like some
Physical therapy.
physical therapy.
And right now I'm going to kind of co-treat with another therapist because with someone that has, and I'll do that, you know, someone's being seen for their back or their hip and they're having these issues and we can justify it because of the connection. I can see them once or twice with their other prescription and we can kind of just clear it with the doctor and make it okay, but we can kind of still go with that. And this is, again, is physical therapy. It's treated under your insurance companies the same way as any other physical therapy would do. But, so, curl your toes, tuck your turtles. That's my advice. 80 times a day. You wanna herd of turtles. 80 turtles a day. Okay. Yay.